research focus of my project part in it. So current problem, we're not just looking at outbreaks in general, but this specific national funding program is trying to look at if we can prevent outbreaks of zoonotic to human infections. And so first of all, we went to the field and did a lot of stakeholder interviews and stakeholder analysis to really get to know what is going on right now and how professionals are collaborating in this field. What we know from literature, but also from all these interviews, is that there is lack of cooperation between three major sectors that are very important for this case: the veterinary, human and public health professionals. And due to that lack of cooperation, it's not clear who is responsible for which part if outbreak happens. You probably have all heard of Ebola. It's not that big, but still we had some bird flu outbreaks in the past in Europe. In Germany there was a big one. You might have heard of EHEC bacteria outbreak. It was a food infection they thought it was cucumber, but it wasn't taugé, the little vegetable. So it's a societal challenge really to find the problem fit. And we also found out that there are uncertainties about the risk perception. So people don't always know is there really any risk to it. So public health professionals might tell you, yeah, there is risk, but well, is it that bad if I go to the farm and pet a lot of animals and don't wash my hands afterwards? Am I really at any risk? So those are the typical questions. And the unique approach we contribute in this sector, because like Catherine said this morning, it might be an advantage we don't have a medical school. We do collaborate with microbiologists, but we really have a very independent position in this field, so we have more objective view, and we try to approach this from the perspective of stakeholder and user involvement. So we first get to know them, and we try to co-create. So whatever we develop will be also developed in agile way, so in iterations, and there is an interesting partner involved, which is a serious gaming development company, which are located at the campus, and they also understand how the research works, and that is very valuable. And we also adopt some game-based learning models and try to combine them with persuasive design here and situational awareness. I will tell about it a bit more. The stage we are right now in is we moved more to design, but I will tell a little bit more about the results. So at the value specification phase, we looked at so what do stakeholders really need, what are their requirements, and how can we translate that to design, to scenarios for the game. And then after each cycle, we iteratively test it with the end users and then go back to redesign. And at the end, the idea is, of course, that we also come up with implementation, and not just the plan, but really the proof of concept implementation and the business case, so how to bring it into practice. There are different, I'm not gonna talk a lot about it. There are different activities we're doing in the project. And of course, publications are important, but we also try to understand like the risk groups, like the young, the pregnant, and the elderly. What do they really know? That's actually the user, the general public perspective. What do they currently know about the zoonotic infections, and how their perception can be understood, so that we, the smart question-answer system that we are planning to design, that it really matches their mental model and their perception. And so that is part that Anne-Marie is doing with other colleague, Lisette Chinkamiet, and also with Ninka. And we are also, that's the gaming part, we're trying to come up with the risk communication scenarios which are specific for certain types of outbreak, and they will be the input for design. But I'll give you the examples. So there are three main parts of the project, and we are focusing right now on the top two. I'm not going to talk a lot about the smart question answer system, but that is the public, general public part. And at the end, they will be integrated in one platform. So if you're a general public, you will be going to you have a question, I'm pregnant, can I take care after my cat, or can I still work in the garden? Then you can go to the question answer system. And I'm talking today about the design approach for game-based learning environment with situational awareness in it. And we are also looking, especially for the implementation part and how to bring this innovation further into how can we integrate it, for example, into social media kit, and can that help to also understand how the risk communication, public health is going on right now, and can we also use that as an implementation tool? So that is something for the further research. In general, so we are adopting the dilemma game concept here, which is new for our group, but it's been used in many kind of crisis management situations, like for firefighters, training firefighters to deal with the crisis management situations, or imagine many majors have to agree on a certain societal topic about the public health policy or whatever, so they can sit at the table. And so it's basically a decision aid tool, so, but in a playful way. So that's how you can see it. It's not gamification, it's real game. So you will see the screenshot in a moment, and I can also demonstrate a little bit. So shared decision-making support during outbreaks. It's not meant to be used while outbreak happens, but as a training tool beforehand, so that you can train certain skills of the professionals, and when outbreak happens, you hope that they are more self-aware of what skills they can apply, and that at the end of the day we can also prevent outbreaks. That's the whole idea behind it. So as you can imagine, in a crisis management situation, if this is infection outbreak situation, or with firefighters, or any kind of natural disaster, what you're dealing with is the pressure, motions, and unclear regulations. And you have to handle and act upon unexpected events. And those are the skills that are needed while you're dealing with it. And we have very specific target users we are using in this project, and cooperating with them and co-creating with them are professionals from the human, veterinary, and public health domains. And public health, it's not just public health services, but also microbiologists that are sometimes attached to hospitals. And we also have regional infection disease professionals that are actually responsible for overlooking the regional policies and the governmental policies and trying to communicate them to the local public health organizations. And so what we are trying to do is design and validate the realistic scenarios translated from the interviews and the focus groups and the real world situations on bird flu and MRSA, which is highly resistant bacteria you can get, for example, if you get into the hospital and there is an outbreak happening and you are a weak patient with lung disease or with low immune system, then you might get it, and it's very hard to control. If that outbreak happens, it has a very negative impact on the hospital image, but also, of course, on the patient's health. So that will be the scenario we will develop next. And right now we are focusing on the bird flu as the first test case to also improve the game. And so what we did, first step, we did a focus group with various infection prevention specialists from different regions, and they had an educational moment. So we were invited to give, instead of a guest lecture, we had the focus group at the University Medical Center Groningen at the north of our little Netherlands country. And they were brainstorming with us what type of scenarios were realistic. And we came up with a couple of scenarios based on the stakeholder interviews. And one of them was, for example, there is a bird enthusiast event organized in an area of Groningen, the same area these professionals come from. So we try to make it as close to their real world. And they expect a lot of visitors today. Actually, we've gone from 400 to 2,000, so it has to be really large scale. And there might be a danger of contamination of public with bird flu. But the way we frame it in the game is a little bit different. Like a bunch of people went to this bird enthusiast event, and then a couple of people got sick, and they go to the GP. And then can the GP really find out if that has anything to do with the bird flu? Will the GP ask them, do you have a pet or anything? What happens right now, they don't really. So they consider it's just a normal flu. And the game tries to suggest to the GP, like, did you think about asking the history, where this patient has been the last week? Maybe it could do with animals. And would you, if you find out that that patient has pets, would you then contact the veterinary doctor and also inform your colleagues, those kind of things. And what is interesting about this scenario, the challenge here is that it has to involve all these 3 different professionals, all these stakeholders, so not just GP, but also the public healthcare professionals and the veterinary. The challenge is also to frame the scenario each time different for different role. And I will tell you a bit about that more. And MRSA outbreak site, which is not in the game yet, but we will work on that probably early in the year. In January we will have the first draft. What happens a lot is nowadays when, for example, an elderly is admitted to the nursing home, there is, you have heard the talk maybe yesterday about the personal health records, how the systems are not connected and you cannot trace the information. This is what happens if the patient has been to the hospital and then comes to the nursing home. There is no transfer of the record, and so people in the nursing home might be unaware that that patient had a risk of MRSA infection, and that could cause an outbreak. And then based on the protocols that are designed by public health policies and also healthcare professionals and the microbiologists, we try to ask what decision would, for example, veterinary doctor or GP make in this case? Would they test if there are 5 patients sick at the same time? Would they isolate them? Would they preventively test, or would they wait till more patients get sick? The important actions here would be to contact a laboratory, which we collaborate with. For example, there is one laboratory in the whole north region of the Netherlands that have all the data sets on the MRSA type of tests and any type of infection tests. And they could also do the screening very fast, but that costs money, so you have to do these decisions. And in general, so before I show you how it looks like, so we have a generic goal in mind. It's not just the game itself and training the professionals, but it's in general supporting risk communication and decision making, infection control. And we see the game just as a tool, as a mean. And we hope that this could match with public health professionals, and the first evaluation results actually show that they think this is a useful tool. But who knows, maybe it has to be with a virtual coach or facilitator. It could be extended, of course. And we hope to continue with that project and find that out, what are the best ways to also design the feedback. And the second goal is to enhance the skills of public healthcare professionals, not just in communicating with each other, but also communicating the risk to the public, to the patients and general public in empathic way. So what happens right now, if you have a bird flu outbreak and a lot of chicken has to be killed on the farm, it has enormous impact, not just on the farmer, but also on the people around and the family. And in many ways, public health policies don't take that into account. And also what happens now is that veterinary doctor and also public GP gets confronted with these societal empathic questions, and they are not prepared for it. So how do you handle that? And in general, the research question is also how to design such a serious game. with an educational impact. So it's not just a game, but it has to train certain skills. And also, we visited Game Institute last afternoon, and that was very inspiring. And we are trying to embed the game mechanics and the game aesthetics and various gaming models in that as well. And what we do is apply participatory iterative design approach and learning models. And not just that, we are trying to also connect that with situational awareness theory. And that's where my research line comes in. So it's not only important to train certain expertise, but it's also important to evaluate if people are actually aware of their actions. And the term shared situational awareness actually means is, are people aware of each other's actions, and are they aware of the risk, and are they able to act upon it? So as you can see, it has connection to decision making. And there are standard evaluation methods to help and test if actually decision making has been enhanced through such a serious gaming tool, for example. You can also ask subjectively if people perceive that that has enhanced their performance in the terms of handling the outbreak. And what you try also to achieve there is that they can achieve their goals and expectations and objectives, and on the long term they gain autonomy, so they're it's more in the self-management direction, and also their training and experiences are captured in this framework. And it's very much connected to interface design. So situational awareness is not just a theory. It can be directly translated into how you design your interface. What are the elements in the interface that are essential, like, for example, ambient features or empathic design features within the game that could enhance situational awareness. So, and plus the e-learning to it. So this is how the game looks like right now. I will explain a little bit how it works. So, for example, you can play from the 3 different roles. We have the GP, general practitioner, we have veterinary, and we have public healthcare professional. So you choose the role. It doesn't have to be your role. Maybe you are curious how veterinary handles the situation. So you can also play from different role. And you get the scenario description. It's now 9:30 a.m. Patients are coming for their consultation. It's a normal day for you. You're just a GP. And then what happens is you're already 10 minutes behind the schedule, so you're a little bit stressed. And then patients are waiting in the waiting room, and they're getting a little bit impatient. And then the next patient you're seeing is Mrs. Smith, and she feels very ill. So she has the complaints like the fever, the sore throat, and the headaches, so something that you could connect to the normal flu. And Mrs. Smith is a 3rd patient that has the same symptoms today. The question is, do you ask your patient for more background information about the potential cause of the complaint, such as ownership, pet ownership, current job, or any particular activities in the past week? And so what you can do here is not just read this, but you can also ask the opinion of your fellow GP or the other stakeholders at the table, which could be your assistant or the patient itself, veterinarian, and also municipal health services. What do they think? How would they answer? But also, can they provide you with extra information? And the question is, would you listen? And how would that influence your decision making? And so in this way, you get a couple challenges. We call them dilemmas throughout the game. And you get also feedback on your performance. I will explain about it in a moment. So currently, it's only the post-game feedback that is embedded in it. And the first aspect is the competences, the skills that they are learning. and we get them from the risk management theory and also communication in risk management. And this is not a complete list, so we just had a first demo, and we are evaluating what kind of competences we should extend. And already now we know that this will be a larger list, and maybe not all of them that are here now are relevant for the future. But right now you get feedback on how does your decision influence the course of Outbreak. So depending on your answer yes or no to the first question and the other questions throughout the game, does it impact positively or negatively the course of Outbreak? Did you make more people sick, or did you handle the outbreak in a way that it actually positively impacts the outcome? And the collaboration, which is one of the most important aspects. So were you cooperative? Did you ask opinion of your colleagues? Did you really ask their information? But it might be, if you're very collaborative and you positively influence the outbreak, then you might be not that efficient on the time management scale, because that takes time to read information. And right now we don't have the limit of time in the game, so as you can see, you have like 46, 36. It's, yeah, ridiculous. You have a lot of time, so almost 50 minutes to play the game, but you can set the limit of time, and then imagine you will be under the time pressure. And that will be then important if you decide to ask for more information, or you decide to answer straight away from your expertise. The second dimension of the feedback is the time spent on each question, on each dilemma. And that gives you insight into your performance, and also which type of question you were, just the insight and awareness about your own gaming style. And empathy, which is very important. So each time you play the game, the system asks you, like, how did you think actually it impacts the fellow GP and the other stakeholders? Depending on your answer, do you think you would make them happy? And not just your stakeholders, but also these three dimensions. Do you think it positively influenced the outbreak course, the collaboration and time management, or not? And that is something that we ask beforehand, and then you can reflect on it at the end. And also, right now, this smileys, you cannot see it, but if you really positively influence the course of Outbreak, the smiley would be smiling, and if not, it would be sad. And we will add to it later is that actually you can see also here the avatars of each stakeholder, and then you can see if they, at the end, if you made them happy or not. So that kind of feedback plus, which is very important. Societal impact. It's not just a game. We try to simulate that you see the newspaper article, and it actually says on the local news there was an outbreak of avian influenza, which is bird flu. And what happened is that you can really read throughout the course of your decisions how that impacted the society. And it's very funny to see what impact it really has on the players. They really think like, wow, I actually impact that, so I have to be very cautious about. But in spite of that, the nice thing was that they said during the evaluation, which we did in July, the first focus group with evaluating the game, they found it looks not boring, and there is a playful aspect to it, and they still realize, even though it's a serious game and it's a realistic scenario, they still have a chance to play it over and apply a different gaming strategy, a decision-making strategy, and learn from it. So they don't think like, oh, I'm not allowed to really click wrong because then I'll do something wrong. And that's the same about feedback. We give them instructions like there is no good or bad. It's just the insight in your playing and decision-making style, and you can always try it again, play it again, and see what's the difference if you apply different strategy. And another thing to mention is here that right now the originally this game was designed to for the face-to-face situations. So then you would have a group of experts and a facilitator who would then explain them the feedback and discuss after the playing, like what kind of insights did you get. What we are trying to achieve is to develop a standalone online learning environment because it's not feasible to expect the GP, the microbiologist, and veterinarians to come together all the time in one space. And that is why we are thinking about the way to capture the facilitator role within the game. And that could be a virtual coach, but it could be also the in-game feedback, which would help the player throughout the game to understand the impact of their decision-making strategy, the different skills that they are gaining. So every time you make a certain decision, you gain points on the different scales. All right, so the next step will be also to assess. That will happen actually tomorrow, the first evaluation of how does it actually impact the performance, and can we include feedback that actually helps players to understand their playing style during the game. And the way we approach that is through iterative prototyping, evaluation, and participatory scenario-based design. So this scenario is being adjusted and validated every time. And for example, the funny thing was we found out after validating this scenario, which is the bird enthusiast event. So this flu symptoms that you get is not likely to get the bird flu from the parrot, which is a pet of Mrs. Smith. It's more likely to get it from a chicken. So we had to redesign a scenario which would be an open doors event on a local farm with a lot of chicken, and it would go on for 3 days. Many people visited it, and then the outbreak happens. And the impact of that change in the scenario means there is also the cleaning of the farm, which is an effect of the outbreak, which means that a lot of chicken have to be killed, and there is like a bunch of people coming, taking over your farm, and that has a lot of consequences for the societal part and the emotional part of the game and the player. So we are really curious about how that will impact their experience. Right now, this was really like a light scenario. They really had fun, and we could discuss about it, but I'm really curious if it has such an impact, if that would still be the case. And what also is important that we are trying to come up with the evaluation framework in general. To how do you evaluate the game artifacts, the design elements, for example, for situational awareness, and the effectiveness of the game in general, and not just in virtual world, in the simulation environment, or during the evaluations with the user, but also in real world. So we plan to implement it in our region, in Twente, but also maybe in several general public health services, then try it for a longer period of time. Then collect the data, the log data, and also embedded questionnaires on how they perceive the feedback and how aware they are of their own decision-making strategy, and even emotions. One thing we are also interested about is how the virtual character's appearance influences the player. And so right now you don't see the difference, but while you are playing, you make somebody happy, they start smiling. And it's really interesting if people notice it, and does that impact really? And also, like right now, we had a pool of like 200 faces to choose from, and we were just having fun and selected something that we thought this character looks more like GP, and we are really curious, like, is that the right way to go? Yeah, it's very funny, but yeah, some characters really are stereotypical, and you can make a link to them. And even the background, like right now it's a standard, doesn't have anything to do with outbreaks. But we are gonna make it more dynamic so that you would have like a chicken ear and even the map, and you will see like, oh, in region Twente, so many people got infected, and then like in pandemic, you have the infection spreading out. And so all those fancy design elements will be added later. So right now we are more focusing on the scenario itself and the feedback. All right, so the deliverables of this project, we will deliver the game-based e-learning standalone module for training. And so right now we are talking also to even the, we call them safety regions, which are governments, local governments. They might be interested in implementing it, but also there is always a postgraduate training of the microbiologists and the veterinarians. So we are talking with various stakeholders if they would be interested to bring the game to the next level, and also continuously invest in not just the support and hosting it, but also developing it further. And the guidelines for stakeholder identification, actually the paper of my colleague a couple of months ago, it already appeared in the journal, and it's about the approach. So how do you really analyze the values of stakeholders? If you're interested, I can send you the paper. And the smart question analysis system, that is like the physical product that we deliver, and the connection with various platforms from the other projects like Healthy Care, Regional Safety and Antibiotic Stewardship Program. We have another platform also for MRSAnet, and we are planning to connect them, and the new project Healthy Care is also connected to this project. So we are trying, the technology that we are developing is not going to be ended by the end of the project, so we're trying to make sure it's a continuous development and implementation of that. And last but not least, what is important is the training module. So more like you can see it as a business case. So if you are trying to implement it in practice, how will it look like? Will you give some incentives if the doctors are going through the extra training? Sometimes they can earn credits. So how that model will look like. If you are offering the training, who will offer it, who will pay for it, and those kind of things. And that we will develop together with the company and the government, whatever stakeholder will be interested. And the guideline also, the policies for educating professionals, like how would you approach it. And as I said, the continuation is within the European project. And this is how our virtual reality lab looks like. That's where we did the first focus group evaluation of the first demo. So what you can do here is not just the virtual reality simulation, but also a very nice environment for brainstorm, where they use scenario-based design to co-create prototypes and systems with the stakeholders and users. And you can set up the different colors, the mood. You can, of course, record everything. It's like a usability lab. And you can also use the theater kind of display to immerse the environment. It can be used as an immersive virtual reality environment as well. So the funny thing is when they come together there, they're really like placed from their safe working environment to a different environment. And they start thinking outside of the box, and they start understanding that they really need each other. So thank you. That's about this part of the project. Thank you very much. I think I'm ahead of time.
That's okay. Yeah. Do we have any questions for Olga? And I think the microphone has to go to the person asking the question.
Yes.
Leila, I saw Leila's hand came up. The microphone is actually for the video. It's not projecting. Here first.
Yeah, so very interesting project. I'm wondering if in the process of design, did you consider any type of like gamer modeling, like if like gamers' personality, especially if there is no incentive for those people who are supposed to use the game in terms of for training, like I think probably that's something need to be considered. So encourage them to play the game.
Yeah, very good question. Thank you. That is why we are also embedding the persuasive design. That will be part of the feedback. So how do you motivate the user, the player, to really continue with the game? And we think the way to do is of course, you're right, and we will design personas to match the user profile and the gamer profile with the role in the game. but also through giving them insight into their playing strategy and the decision-making strategy. That would be the incentive. It's the same, you can compare it with the self-monitoring, like if you use wearables, so you get feedback on your performance, how are you reaching your goal, and maybe we can add some goal setting to this as well. That depends. Maybe you can choose like the set of skills you want to train. Maybe you don't want to train them all in one go. And depending on that, you can also do personalization. What we do not have right now, as you saw, there is no avatar for yourself as a player. So you do not see yourself at the table. And that is something to consider, because right now you cannot choose your own character, but that could be something interesting. And also the facilitator role, it's not really in the virtual character, not embodied right now, but you could use that also as the... Does that answer your question? Yeah?
Oh, okay. So this is a very interesting scenario. Yeah, thank you. And I have two questions. So the first one is that it seems that this game is based on like single player. Is it possible to like multiple players to collaborate like in this game? And the second question would be like echo the first one. Would you expect to see like difference in terms of how people should doing like shared decision making, like with a real person and a virtual partner?
Okay. So the first question about the multiple players. Right now it's a web-based online flash-based game. So you can play with several players at the same time. It's no problem. And I actually think interesting thing. So what you see here. If you're interested later, I can give you a short demo and show you how it works. So you don't necessarily have to be aware these are not real players on the other side. You don't know. Maybe you're playing against a real GP or a veterinarian, which looks like a virtual character.
No, you could have an experimenter that
Exactly.
was controlling
Yeah.
some of the decision.
Yeah. And we know this, like if you have an automatic dialogue with a virtual coach, there are like speech engines that analyze speech and produce very smart answers. I wrote that program in my first programming class, I think, and it's very interesting. People don't understand it's a robot behind. There is an engine behind. They think it's a real person talking to you. So I really saw during the evaluation that people take the stakeholders very seriously. You would tell them many times, you should contact the veterinary professional much more often about this. They're like, why should I? I'm just doing my job. I take care of the patients. Once they play the game, they start to consider, hey, maybe he has something important to say. Maybe it's a good idea to involve that person. So that is something we have to find out. But even though it's right now one player like scenario online type of thing, I still see it as a shared decision-making tool, because your decisions depend on the others and vice versa. So that is something interesting also in the evaluation, I think. And can you repeat the second part?
I think you already answered the second question as well. Yeah.
Thank you.
Great, Olga, thank you. My question is, have you, during the evaluation, have you noticed like a particular pattern with regards to like which of the characters people approach most and which one of those
That's a
are
good
most
one. Yes,
influential in
yes.
their decisions?
Yeah, very good. Yeah, I've been observing that, and it's you have of course a hypothesis. You think like you expect something. So like GP, of course, they ask fellow GP, but to my surprise, they said it's in normal practice. Even though during the game it was like their intuitive way of doing things. Like of course, I ask my colleague or an assistant, and like you have the camps in this world. So in this type of domain, they have camps. So natural camps are the GP with the public health services. They listen to each other, they trust each other. And on the other hand, there is a camp veterinary and municipal health services. And what you see is that is the natural combination. for them. So that's what I saw, that the GP would ask municipal health services very often, the assistant, the patient as well, because that is your first responsibility, to help the patient. But they said, like, really, in this situation, my colleagues don't influence my decision making. I mean, of course, if there is outbreak happening, I would inform my colleagues that there is a danger, and they might be aware of, like, watch out if there is patient coming with this kind of complaints, you might consider it a bird flu. But besides from that, this is not a relevant stakeholder, so we are replacing it with microbiologists, actually, and infection disease doctors. That is something we see while we evaluate. That is very interesting, good question. Yeah, I mean, we might want to analyze that through log data we are collecting. Must be something we want to analyze, in also long term. Thank you. Yes?
I remember a movie, Do You Want to Be a Millionaire or something like that.
Yeah.
And one of the questions that the person could ask is for more information, or like the spelling bee, can you give me more background? So would there be the possibility of having other players that could give that information, like the farmer, like the whatever?
Thank you. That's a very good question. Actually, there are different types of dilemma games, as I said, also in crisis management. And to get inspiration, we played different ones that are already released on the market. And you can actually have a stakeholder, a media, which would be, you can even like give prompts. There is an important information for you, but you have to go to a website and read it. And then you have to make a decision. Do you have time for this? Is this valuable? But we do get response from the players that they find at the beginning stage, the first question they get, the beginning of the dilemma, that is very important. That's the first thing they need, to collect information. That empowers them. So we will definitely involve that, but right now already. So what you do when you click on these ones, you get here extra information, which is related to the expertise, for example, from veterinarians. Something that you don't know yet, but they do. And the funny thing is, they don't realize it right away. It can have with the, to do with the intuition, in how intuitive is the interface right now. So they don't see it right away, or the necessity to click on the extra information. But once they get to know the game and they understand, okay, I can get more information, they start making use of it. And it's not just getting more information. They can evaluate, do I find this information actually valuable? And later, did that impact my decision? So they can reflect on it. And that is very interesting to see. At the end, they also get feedback, like how many stakeholders did I ask the information from, and how much information did I actually value in my decision making. That is,
One of the ways that farmers get information, for example, on outbreaks here, is through Twitter.
Yeah,
so,
exactly.
you know, that could be, and of course, Canada's had a very serious outbreak some years ago, the SARS outbreak, which really totally showed us how exposed we were to outbreaks.
Wow, that's good to actually in September, Lisette was in Stanford and showed the demo, and anyhow, very interesting to see how different cultures would respond to such a game. And so what we are doing in the social media domain, even that digging into data project, we are trying to mine the social media data. There has been some research on how general public reacts to outbreaks and how they actually are influenced by the Twitter message, for example. Do they start panicking? How does it influence the general perception? In the case of Ebola, remember how much impact that had, and Mexican flu outbreak, and how does that impact the policy decision making? So it's definitely very interesting research question, and something we really are considering to embed. Definitely good suggestion. Thank you.
I think in the interest of time, we'll call it at this point. We still have a few minutes for you to come up and, as Olga's wrapping up, say a few words to her. For those of us who are on the rest of our agenda, we're going back to EC4 now, so back to our room on the second floor. You know who you are. And for the rest of you, I thank you very much for coming, and I hope that you might join us on some of the other talks that we're going to have this week. In fact, I actually forgot a talk, because on Friday, Rita's presenting on persuasive technology, so this really is the persuasive technology marathon week. So So
Nice.
I don't remember the details. Do you want to say when you're talking?
Actually, my talk is about persuasive technology into application areas. I'm going to look at it, application in health domain, and I'm also doing another project in technology for development where I'm working with developed countries in different aspects of the applications and stuff like that, all related to development. So you're invited. It's actually going to be in DC, I think 1301 at 11:30. 1304, right? Yes, at 11:30 on Friday.
11:30 Friday, DC 1304. More persuasive technology.
Um, Thank you so much for interesting discussion, your attention. The project I didn't get a chance to talk about, that was too ambitious. But if you are interested in virtual coaching, lifestyle management, and visualization of multi-sensor data, I'm happy to share some papers with you and talk about that more throughout the week. So, thank you.
Very happy to get people in touch with